ಇನ್ಸ್ಟೆಂಟ್ ಏರಾದಲ್ಲಿ ನಾವಿದೀವಿ. ನಿಮ್ಗೆ ನಿಮ್ಮ ಬೆರಳಿನಿಂದ ಒಂದು ಕ್ಲಿಕ್ ಕೊಟ್ರೆ ಮನೆ ಬಾಗಿಲಿಗೆ ಸಾಮಾನ್ ಬರುತ್ತೆ, ಮನೆ ಬಾಗಿಲಿಗೆ ಊಟ ಬರುತ್ತೆ, ಮನೆ ಬಾಗಿಲಿಗೆ ನಿಮ್ಗೆ ಬೇಕಾಗಿರುವಂತಹ ವಸ್ತು ಬರುತ್ತೆ. ಅದೇ ಬೆರಳನ್ನ ನೀವು ದೇಹದ ಬೇರೆ ಬೇರೆ ಭಾಗಗಳಲ್ಲಿ ಆಕ್ಟಿವೇಟ್ ಮಾಡೋದಕ್ಕೆ ಸಹಾಯ ಮಾಡ್ಕೊಂಡ್ರೆ ನಿಮಗೆ ಯಾವುದೇ ಕಾಯಿಲೆನ ಹೀಲ್ ಮಾಡ್ಬೋದು ಅಂತ ಇವತ್ತಿನ ಗೆಸ್ಟ್ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಸೊ ನಿಮ್ಮ ಬೆರಳಿನ ತುದಿನಲ್ಲಿ ಯಾವ ಶಕ್ತಿ ಇದೆ, ಯಾವ ಕಾಯಿಲೆನ ಯಾವ ಪಾಯಿಂಟ್ ನ ಟ್ರಿಗರ್ ಮಾಡೋದ್ರ ಮೂಲಕ ನೀವು ಹೀಲ್ ಮಾಡ್ಕೋಬಹುದು ಅನ್ನೋ ಮಾಹಿತಿನ ಇವತ್ತಿನ ಇನ್ಫೋರ್ಟ್ ನೋಡಿ ನಾವು ಕೊಡ್ತಾ ಇದೀವಿ. ಸೊ ವೆಲ್ಕಮ್ ಟು ಇನ್ಫೋರ್ಟ್ ನೋಡಿ.
ಕಂಟೆಂಟ್ ಇಷ್ಟ ಆದ್ರೆ ಲೈಕ್, ಶೇರ್ ಅಂಡ್ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ.
ವೆಲ್ಕಮ್ ಟು ಇನ್ಫೋರ್ಟ್ ನೋಡಿ. ಇವತ್ತು ನಮ್ಮ ಜೊತೆ ಇದ್ದಾರೆ ರಮೇಶ್ ಸರ್ ಫ್ರಮ್ ವೇದಶ್ರೀ ಅಕಾಡೆಮಿ. ಸರ್, ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ಸರ್, ಈಗ ವರ್ಮಕಲೆ ಅನ್ನೋದು ಪುರಾತನ ಕಾಲದಿಂದ ನಮ್ಗೆ ಚಿಕಿತ್ಸೆಗೆ ಬಳಸ್ತಾ ಇದ್ದಂತಹ ಒಂದು ವಿಧಾನ. ಸೊ ವರ್ಮಕಲೆ ಅಂದ್ರೆ ಏನು, ಹೇಗೆ ಚಿಕಿತ್ಸೆ ಮಾಡ್ತಾರೆ?
ವರ್ಮಕಲೆ ಅನ್ನೋದು ಈ ಡಾಕ್ಟರ್ಸ್ ಎಲ್ಲ ಬರಕ್ ಮುಂಚೆ, ವೈದ್ಯರ್ಸ್ ಇರೋಕ್ ಮುಂಚೆ ಒಂದು ತಾಯಿ ಮಗಳಿಗೆ ಹೆಂಗ್ ವೈದ್ಯ ಮಾಡಿರ್ಬೋದು. ಯಾರು ಇರ್ಲಿಲ್ಲ, ಯಾವ್ದೇನೋ ತೊಂದರೆ ಬಂದ್ರೆ ಹೆಲ್ತ್ಗೆ ಏನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿರ್ಬೋದು ಅಂತ ನೀವು ಯೋಚನೆ ಮಾಡ್ರಿ. ಏನಾಗಿರುತ್ತೆ ಅಂದ್ರೆ ದಿಸ್ ಪೀಪಲ್ ಸ್ಟಾರ್ಟೆಡ್ ಟ್ರೈಂಗ್ ಟು ಡೂ ಸಮಥಿಂಗ್. ಕೈಯಲ್ಲಿ ಹಾಕಿ ಏನೋ ಟ್ರೈ ಮಾಡಿದ್ದಾರೆ, ಸರಿಯಾಗಿದೆ. ದಿಸ್ ಇಸ್ ಬಿನ್ ಡಾಕ್ಯುಮೆಂಟೆಡ್ ಫಾರ್ ಸೋ ಮೆನಿ ಜನರೇಷನ್ಸ್. ಇದನ್ನೇ ಒಂದು ಟೈಮಲ್ಲಿ ಏನ್ ಮಾಡಿದ್ದಾರೆ, ಈ ಸಿದ್ಧರ್ಸ್ ಅಂತ ಇದೆಯಲ್ಲ, ರಿಷಿಸ್ಗಳು, ಸಿದ್ಧರ್ಗಳು, ಇವ್ರಿಗೆಲ್ಲ ಏನ್ ಮಾಡಿದ್ದಾರೆ, ಇದನ್ನೇ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಮಾಡಿ ಇದನ್ನೇ ಡಾಕ್ಯುಮೆಂಟ್ ಮಾಡಿದ್ದಾರೆ ಮ್ಯಾನುಸ್ಕ್ರಿಪ್ಟ್ ಅಲ್ಲಿ, ಪಾಂಬ್ಲಿಕ್ ಮ್ಯಾನುಸ್ಕ್ರಿಪ್ಟ್. ಇದು ಆಲ್ಮೋಸ್ಟ್ 128 and more ಮ್ಯಾನುಸ್ಕ್ರಿಪ್ಟ್ ಇದೆ ನಮ್ಮ ಹತ್ರ, ಒರಿಜಿನಲ್ ಸೋರ್ಸ್ ಡಿಜಿಟಲೈಸ್ಡ್. ಈಗ ಅದರಿಂದ ಆಕ್ಚುಲಿ ಈಗ ಡಾಕ್ಯುಮೆಂಟ್ ಮಾಡಿ ನಾವು ಇದನ್ನೇ ಮುಂದಕ್ಕೆ ತರಿಸ್ತಾ ಇದೀವಿ. ಏನಂದ್ರೆ ಬರೀ ಕೈಯಿಂದ ವೈದ್ಯ ಮಾಡೋದು, ಬರೀ ಕೈಯಿಂದಾನೇ ಮ್ಯಾನುಕ್ಯುಲೇಟ್, ಬೇರೆ ಇರಲ್ಲ. ಫಾರೆಸ್ಟ್ ಅಲ್ಲಿ ಹೋಗೋದ್ರೆ ಏನಿರುತ್ತೆ, ಮೆಡಿಸಿನ್ ಇರುತ್ತಾ, ಸರ್ಜರಿ ಮಾಡೋಕ್ಕಾಗತ್ತೆ, ಏನಿಲ್ಲ. ಎನಿ ಎಮರ್ಜೆನ್ಸಿ ಏನ್ ಮಾಡ್ತೀರಾ, ಅವಾಗ ಏನ್ ಮಾಡಿದ್ದಾರೆ, ಬರೀ ಕೈಯಿಂದಾನೇ ಮ್ಯಾನುಪ್ಯುಲೇಟ್ ಮಾಡಿದ್ದಾರೆ. ಇದು ಒಂದು 108 ಸ್ಥಳಗಳಿದೆ,
108 ಪಾಯಿಂಟ್ಸ್ ಬಾಡಿನಲ್ಲಿ,
108 ಪಾಯಿಂಟ್ಸ್ ಅದೇ. ಇದನ್ನೇ ಒಂದೊಂದಕ್ಕೂ ಬಡವರ್ಮ ಅಂತೀವಿ. 100 ಇದೆ. ವೆನ್ ಯು ಪ್ಲಸ್ ಟೂ ಮಚ್ ದೆನ್ ಇಟ್ ಈಸ್ ಡೆತ್. ರಿಮೈನಿಂಗ್ 96 are there. The 96 are manipulated to heal the pain. ಓಕೆನಾ?
ಸೊ ಯು ಯೂಸ್ 96 ಪಾಯಿಂಟ್ಸ್ ಟು heal the pain.
Heal the pain.
ಸೊ ಯಾವ್ಯಾವ ಕಂಡೀಷನ್ಸ್ ನ ಹೀಲ್ ಮಾಡು?
See, this is only 3 conditions we can do. One is a bone related issues, nerves related issues, and psychosomatic and mind related issues. Only these 3 can be cured.
ಸೊ ಇಫ್ ಯು ಕ್ಯಾನ್ ಗಿವ್ ಅನ್ ಎಕ್ಸಾಂಪಲ್ ಫಾರ್ ಸೈಕೋಸೊಮ್ಯಾಟಿಕ್, ಬಿಕಾಸ್ ನಾವು ತುಂಬಾ ಕಷ್ಟ ಪಡ್ತಾ ಇರ್ತಾರೆ, ನಿದ್ದೆ ಬರೋದಿಲ್ಲ. ದೇರ್ ಆರ್ ಸಮ್ ಪಾಯಿಂಟ್ಸ್ ಯು ಕ್ಯಾನ್ ಜಸ್ಟ್ ಟ್ರಿಗರ್ ಅಂಡ್ ಸ್ಲೀಪ್ ಪೀಸ್ಫುಲಿ. ಅಥವಾ ಬೇರೆ ಏನೋ ಸೈಕೋಸೊಮ್ಯಾಟಿಕ್ ಡಿಸಾರ್ಡರ್ ಅವ್ರಿಗೆ ಕಾಡ್ತಾ ಇರುತ್ತೆ, ಸಮ್ ಟ್ರಿಗರ್, ಸಮ್ ಆಂಗರ್, ಸಮ್ ಆಂಕ್ಷಿಯಸ್. ಸೊ ಆವಾಗ ಯಾರ್ಯಾರು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋಬೇಕು ಅಂದ್ರೆ, ಇಸ್ ದಟ್ ಆಲ್ವೇಸ್ ಅವರು ಫಿಸಿಷಿಯನ್ ಹತ್ರಲ್ಲೇ ವಾಪಸ್ ಬರಬೇಕು ಅಂತನಾ, ಅಥವಾ ಯು ಟೀಚ್ ದೆಮ್ ಅಂಡ್ ದೇ ಕ್ಯಾನ್ ಡೂ ಇಟ್ ಆನ್ ದೆನ್ ಸೆಲ್ಫ್?
See, nowadays it's became mandatory that for everything you go to hospital at thing. When my granny was there in my town, I never went to hospital for any pain management because she'll take some oil, oil tagodare, heat ಮಾಡ್ತಾರೆ, immediately she'll do some massage. 10 ನಿಮಿಷದಲ್ಲಿ ಸರಿ. ಈಗ since I'm missing that nadis therapy nowadays, we supposed to go for
Hospitals and doctors.
oh sorry, but I'm telling you, your lifestyle disorders should be taken care by yourself. ಎನಿ ಕ್ರಾನಿಕ್ ಅಂಡ್ ಅಕ್ಯೂಟ್ ಅಂದ್ರೆ ನೀವು ಹೊರಗಡೆ ಹೋಗಿ ನೀವು ನೋಡ್ಕೋ, ಡಾಕ್ಟರ್ಸ್ ಇಸ್ ಕಂಪಲ್ಸರಿ ಬಾದ. ಬಟ್ ನಾನು ಬ್ಲ್ಯಾಕ್ ಟೀ ಕುಡಿದ್ರೆ ಚೆನ್ನಾಗಿದೆ ಅನ್ನೋದು ಡಾಕ್ಟರ್ ಬೇಕಾಗಿಲ್ಲ. ಹೋಪ್ ಯು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ದ ಘೀ ಇಸ್ ಗುಡ್ ಫಾರ್ ಲ್ಯಾಕ್ಸೇಟಿವ್ ಇದ್ರೆ ನೋ ಒನ್ ವಾಂಟ್ಸ್ ಟು ಟೆನ್, ಬಿಕಾಸ್ ಮೈ ಆನ್ಸೆಸ್ಟರ್ಸ್ ಡಿಡ್ ದಟ್ ಫಾರ್ ವೆರಿ ಲಾಂಗ್ ಟೈಮ್. ದೇ ಲಿವ್ಡ್ ಫಾರ್ 120 years. Now after all that is there, we could not live for 100 years or too much 100. I'm talking more than 60 years. So what happens here is that this manipulation technique should be learned by every house. Like, see, bird or two, people ask to, like, every house, one has to be in the middle. But now this the third world war, I'm talking about disease. Now every house, one should learn this at least to come out of the pain management therapies or pain management medicines. Because most of your diseases because of side effect of the pain management tablets and other things. So we will teach mostly. Example I'll tell you. If you come to me with a headache, I'll ask you to come and I'll teach you and also I'll treat you. Once I treat you, you'll get confidence. Yen barutte, oh, nang seri ayitu, onsala muttudru sir seri ayitu. Confidence make you to learn yourself first. Avage enagutte will make you to learn lot of systems like this. Not only this, even paralysis case ನಮ್ಮ ಹತ್ರ ಬಂದ್ರೆ ಏನ್ ಮಾಡ್ತೀವಿ, ವರ್ಷ ಆಗೋದಿಲ್ಲ ಬಾಕಿ, for years they have come.
Yes.
For that what I do, I'll ask some caregivers, sister, brother, son, ಜೊತೆ ಬರಕ್ಕೆ ಹೇಳ್ತೀನಿ. So I treat them and I'll also train. So 3 sittings I give and I'll tell them, go 3 months you treat at home. Then come back. Next technique I'll teach. Then slowly I'll see the improvements and change the patterns also. That's why, because one thing will not heal permanently. So I'll change the pattern of healing and so that they will be permanently healed. In this, one advantage is that the painful patient don't want to travel to the every day. Try because already is suffering. Second is, I'm worried too much about the caregiver now. ಯಾರು ಕೇರ್ ಗಿವರು ಒಂದು ಕೆಲಸ ಬಿಟ್ಟು ಆಫೀಸ್ ಬಿಟ್ಟು ಲೈಫೇ ಅಲ್ಲ ಅನ್ನತ್ತೆ ಅವ್ರದ್ದು ಕೇರ್ ಗಿವರ್ ಇವರು ಬಿಕಾಸ್ ಡಿಸೀಸ್ ಅವ್ರು ಉಮರಿ ಹಾಕಂಗಿಲ್ಲ ಜೊತೆಯವರು ಕೇರ್ ಗಿವರ್ ಇದಲ್ಲ I'm worried about them because I seen the ICU patient sleeping inside with anesthesia. The person who is an attender can't sleep for a second. You know that he'll be keeping his ears open with ಯಾವಾಗ ಕರೀತಾರೋ ಏನ್ ಎಮರ್ಜೆನ್ಸಿನೋ it's a tough sir. So that's the reason that I don't invite the patients for the OPER treatment. Is that I train them and get treated them sir for all the things. Psychosomatic bone related or nerve related, you got Alzheimer's another thing really.
ಸೊ ಈಗ ವಾಟ್ ಆಲ್ ಕಂಡೀಷನ್ಸ್ ಹ್ಯಾವ್ ಯು ಹೆಲ್ಪ್ ದ ಪೇಷಂಟ್ಸ್ ವಿತ್
Now-
ಎಷ್ಟು ವರ್ಷ ಪ್ರಾಕ್ಟೀಸ್
So mostly you see that this is in Bangalore. We have to think of your migraine sinusitis because most of the outside people stuck at Bangalore environment, they are not adaptable, and most of these people are kapha. Most are kapha. That's why they get OB and other thing rapid because of the kapha body. Become lazy. They don't get up by morning 5 o'clock, 6 o'clock. They get up by 8 o'clock because they say Bangalore climate is like that. But no. Local Bangaloreans still they get up by 5 o'clock and they go to the agricultural land, paddy land, and they do their work. But outsiders they can't adapt it. So that mostly what I am doing, this type of cases are most negative. For them, I'll train them and teach them, and mostly my videos are available. You can learn from your YouTube and other channels too. But I'm telling you, the channel which you are getting it is not authentic always, like because even I teach, but not for every patient to be. So that we need a place like this to people to come learn.
ಸೊ ಹೌ ಲಾಂಗ್ ಡಸ್ ಒನ್ ನೀಡ್ ಟು ಲರ್ನ್ ದಿಸ್ ಟೆಕ್ನಿಕ್
See, it's not too long. Depends on the person's passion or just you want to earn money. Two things are there. One is a passion. People learn faster. Want to make money. People learn little slow. But for a Vaidya, really, they have to learn at least 3 months. We have an online program and 7 days they have to come directly and stay here. And so we call it as Kai Bhagam, Sai Bhagam because this source of this is from somewhere in the end of the Kanyakumari in Kerala. What this system has come from. So they tell it as they mention that without the touching you can't feel it. If I want to give you the feeling, I want to make you to touch the way I am touching it. Like you want to have a mother touch, means you cannot get a mother touch till you become a mother. But before that, if I want to teach you, I want to make you to feel like you are a mother of someone you are touching it. So that practice is most important for me. So we
7 days.
which is 3 months online and 7 days off.
ಸೊ ಹೂ ಆಲ್ ಕ್ಯಾನ್ ಲರ್ನ್ ದಿಸ್
Anyone who is passionate to cure others or cure themselves, most important. No sir, I want to take small things are happening. There we are somewhere around 12 days online program, which is only for them. They can cure themselves like sinusitis, migraine, other thing for 12 days online. Finish. They can learn on the 12 days online. Every way it will be like 45 minutes. They can learn that. No sir, I want to be a therapist. Really, I want to help others. In that case, they have to come for the 3 months.
ಸೊ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಆಲ್ ದಿಸ್ ಈಗ ನಾವು ಟೆಕ್ನಿಕ್ ನ ಕಲ್ತ್ಕೋಬೇಕು ಅಂದ್ರೆ ಹೌ ಡಸ್ ವರ್ಮಕಲೆ ವರ್ಕ್ ಇವಾಗ ಯಾವ್ದೋ ಒಂದು ಪಾಯಿಂಟ್ ನ ಟ್ರಿಗರ್ ಮಾಡ್ಬೇಕು ಅಂದ್ರೆ ವಾಟ್ ಇಸ್ ದ ಟೆಕ್ನಿಕ್ ದಟ್ ಯು ಟ್ರಿಗರ್ ದೋಸ್ ಪಾಯಿಂಟ್ಸ್ ಅಂಡ್ ಹೌ ಡಸ್ ಇಟ್ ವರ್ಕ್ ಆನ್ ಯೋರ್ ಬಾಡಿ
When you are asking the question, only 1 second you did like this and then you are talking to. That 1 second you are aware or not? Not most of the people you are aware of that. They scratch here and they are not aware. What is my name? Let audience say because he introduced. If they remember my name, maybe they are having very good IQ and remembers. If they scratch here, then they really having up to this much it has come, after that it's not coming. They are trying to scratch here. That's why we can't go to Ganapati temple and tap here, you get a memory power increased. Is that Poihe Varmam is there, which will act.
ದಿಸ್ ಪಾಯಿಂಟ್
Exactly.
ಸೊ ಯು ಹ್ಯಾವ್ ಟು ಆಕ್ಟಿವೇಟ್ ದಿಸ್ ಪಾಯಿಂಟ್ ಫಾರ್ ಯೋರ್ ಮೆಮರಿ
Exactly. But it is scratch here, then I know it's a monkey scratch. That means you are confused like my name, Ramesh Babu. You may confuse that Ramesh Babu or Suresh Babu. Then you'll scratch here. That's not confused state.
ಓಕೆ
Some people scratch here. That means whatever they are going to tell is going to be lie. Sulel Taranta. They are making story out of it. Somebody want money from you. They ask someone, Hemtiku, Sharila, Sar, Salva, Dudubetu, Nilli. If the hand goes, they made a story out of something and keeping the money out of. Very simple. So just your body itself knows where is the Varmam is. I don't know to teach. This is called Poihe Varmam. This is Uchi Varmam. This is called Serum Golli Varmam. All the Varmam, did you learn already? In the code comes Murti Varmam. If you do that, running nose will stop.
ದಿಸ್ ಪಾಯಿಂಟ್
Exactly.
Okay.
ಹೊಟ್ಟೆ ತುಂಬಿದ್ರೆ ಹಿಂಗ್ ಮಾಡ್ತೀರಾ? Why ಇಲ್ಲ ಸರ್ ನಾನು ಉಲ್ಟಾ ಮಾಡ್ತೀನಿ? No one will do. Word why they do like this only? Why? That activates the digestive system of that particular Varma or that particular place. People, anxiety people press like this, means all the Varmam in the handle, that is the anxiety. That's why they get pressing like this. You see that actually?
Yeah.
Every posture you sit like this, then you know what posture you are. Of course, you are killing yourself because your left, right leg is paining. That particular nose, you are trying to press the knee of the left leg so that you are sitting like this. Otherwise, no one is comfortable sitting in one side for a very long time. This is the best posture. But still they sit. The reason is that the pain nose is pressed towards the knee and you are getting hit. Why you sit like this? In the class 2, if you sit like this, what they say? Hey, sit straight. Why? You'll go to sleep. Why? Because there is called Urakka Kalam, this point will automatically touch when you do like this, then you get into sleep. So it's not.
If you don't get sleep, you can sit like this for a while and sleep.
That's why in so many patients I say that have a dinner by 6:37 and all, then after 8, 9 o'clock go to the bed. Sleep on the belly. Keep the hand like this and read the book you hate to read, or if you are married 10 years, take a marriage album and see. Within 15 minutes, I guarantee you, because album is good because it's laminated, all your saliva will be on the book is get spoiled. So it's very beautiful, deep sleep. That's people teach, samadhi sleep, yogic sleep. No. This is the infant sleep. That means you sleep like a child, put the finger inside and you'll be sleeping for a longer time. This is the sleep you want for at least 3 hours, at least weekly once, to heal your body by your own immune system. That's the sleep you want. So that works beautifully. Along with that, we also tell you for sleeping for pregnant women for normal delivery, because you go to hospital, they threaten you that you have BP, you have sugar, you have to go for C-section. So to come out of it, at least like you have to protect yourself. Whatever they say, that's their job. But how do you protect yourself? That take this 3 finger and we have one oil, which is just a sleep oil. It's a sleep oil, means sedative. It's done by Ayurveda production. Just take few drops, and what you do, just lie down on the easy chair and do like this. You have to do 50 times. I never seen anyone completed 50.
They sleep.
They go to sleep. And that is daytime sleep also you can do in the easy chair, so that this pregnant woman, that fear of delivery will go away.
Okay.
They will have confidence, so that what will happen, their sugar level will come down, their BP will become normal because diabetes won't increase because of the fear. All that will also come down. So manashanti, that means the mind will completely clear, so that you are ready to face anything. Even you want somebody is going to fight at you, they are going to scold you, 2 minutes before they come to like this. Or do for them, do like this.
Why is this?
This is called Ottu Varmam. In the movie also, in Indian movie you might have seen, you hit this place and saliva will keep on coming to you. So people have saliva problem, this point is used. And this also you see for the children, when they ask for costly item in the mall and you don't have financial back to buy that immediately hold them and tell that next time kana. When you hold this, they will get convinced. If you don't hold it, they won't get convinced. This point is called convincing fight. Because it will bring your breath to the center, Sukshma. Left and right is need from all this from the world. Sukshmana is and 5 perfect.
Sushumna nadi is activated and your
So your body 108 is working with your activities. In that 98 is connected to 98 of your emotions, anger, fear, loneliness, your Panchabhuta, Dasavayu, Dasanadi, all that is connected to this. So 98 Parma connected to 98 of your actions. And 12 is connected to your chakra left side in and yam. That 5 is really connected to Panchabhuta. 2 is, 1 is Uchi and another is Mulada. So the total point is connected for you to live as a yogi. And 98 is to protect you from the disease. That's a beauty created by the Shiva, given to the Parvati. From the Parvati, it has come to the Subramania, and Subramania to the Agastya or other Siddhas. Like there is a different stories are there. But up to that, it is starting by the Shiva. So he is a killer. If he creates a healing system, means how intelligent will be, because he know how the people die, and he is creating healing means the secret of death he knows, so that he protect you from the death very easily. And death is because of the pain. The first thing what he is teaching to the Varma is to be out of the pain.
So ಇಷ್ಟು ವರ್ಮಗಳ ಬಗ್ಗೆ ತಿಳ್ಕೊಂಡ್ರಿ. ಸೊ ವೇರಿಯಸ್ ಪಾಯಿಂಟ್ಸ್ ಯು ಹ್ಯಾವ್ ಅಂಡರ್ಸ್ಟುಡ್. ಇವಾಗ ಟು ನೇಮ್ ಆಫ್ ಫ್ಯೂ ಡಿಸೀಸ್, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಈಗ ಟಯರ್ಡ್ನೆಸ್ ಆಗುತ್ತೆ. ದ ಎಂಡ್ ಆಫ್ ದ ಡೇ ಯು ಫೀಲ್ ಸೋ ಟಯರ್ಡ್ ಅಂಡ್ ಕೆಲಸ ಮುಗಿಸ್ಕೊಂಡು ಬಂದು, ಬಟ್ ಸ್ಟಿಲ್ ಯುವರ್ ಡೇ ಇಸ್ ನಾಟ್ ಡನ್. You have to come back home and you will have the next part of your life beginning. So at time if you want to energize your body, so ಯಾವ ಪಾಯಿಂಟ್ ನಾನು ಅಪ್ರಿಗಮ್ಮ?
Possibly you are there in front of the camera for a very long time, so that you get energy when you see the camera. For me, I am allergic to the camera. I won't get energy at all. So before you call me for coming for the video, what I will do is that first I will press this point called Sukshmana Nadi point. Just hold munadi, I press it forward like this.
Okay.
And you also sit straight now. Take your long breath and let it go. Take a long breath and let it go. You feel your breath. Now you take your thumb finger and press that point. Little pain, let it come. Inhale and let it go. And now remove the finger and feel your breath. Don't join the hands when you're breathing. Yeah. Feel the breath. Breath will change. Breathing one press. You'll have a big, wide, lungs will open now. Just pressing a point, you see the lungs opening a little wider than their level. Think like you take a long breath, calculate the time. Now we press this point and do the long breath. At least like 10 to 20 seconds increased. That means you will have the capacity of more oxygen. I'll get a lot of energy to present here.
ಸೊ ವೆರಿ ಸಿಂಪಲ್ ಟೆಕ್ನಿಕ್. ನಿಮ್ಗೆ ಏನಾದ್ರು ಟಯರ್ಡ್ ಆಗ್ತದೆ, ಆಫೀಸ್ನಲ್ಲಿ ಕೆಲಸ ಮಾಡೋದಕ್ಕೆ ಸಾಧ್ಯ ಆಗ್ತಾ ಇಲ್ಲ, ಯು ಆರ್ ಲೈಕ್ ಡನ್ ಫಾರ್ ದ ಡೇ ಅನ್ಸಿದ್ರೆ ನೀವೇನ್ ಮಾಡ್ಬೇಕು, ನಿಮ್ ತಮ್ ಫಿಂಗರ್ನ ಈ ನೋಸ್ ಸೆಪ್ಟಮ್ ಮಧ್ಯದಲ್ಲಿ ಇಟ್ಕೊಂಡು ಅದಕ್ಕೆ ಮುಂಚೆ ಒಂದ್ಸರ್ತಿ ದೀರ್ಘವಾಗಿ ಉಸಿರಾಡಬೇಕು. ಬ್ರೀತ್ ಇನ್ ಅಂಡ್ ಬ್ರೀತ್ ಔಟ್ ಡೀಪ್ ಆಗಿ ಮಾಡಿ. ಅದಾದ ನಂತರ ತಮ್ ಫಿಂಗರ್ನ ಈ ಫಿಂಗರ್ ಅಲ್ಲಿ ಇಟ್ಕೊಂಡು ನಿಮ್ಗೆ 2 ಫಿಂಗರ್ಸ್ ನ ನಾಸ್ಟ್ರಲ್ಸ್ ಮೇಲೆ ಇಟ್ಕೊಂಡು ಜೋರಾಗಿ ಉಸಿರು ತಗೊಂಡು ವಾಪಸ್ ಬಿಟ್ಟಾಗ ನಿಮ್ ವಿತ್ ನಾಯ್ಸ್ ನಿಮ್ಗೆ ಉಸಿರಾಟ ಆಗುತ್ತೆ. ಅದಾಗಿ 2 ಸೆಕೆಂಡ್ ರಿಲ್ಯಾಕ್ಸ್ ಮಾಡಿ. ಯು ವಿಲ್ ಹ್ಯಾವ್ ಆಲ್ ಎನರ್ಜಿ ಫಾರ್ ದ ನೆಕ್ಸ್ಟ್ ಹಾಫ್ ಆಫ್ ದ ಡೇ. ಸೊ 1 ಟೆಕ್ನಿಕ್ ಆಯ್ತು.
Ready to.
ಸೊ ಇವಾಗ ಇಫ್ ಐ ಆಮ್ ನಾನ್ ಹಂಗ್ರಿ, ಮೇ ಬಿ ಐ ಯೂಸ್ ಟು ಹ್ಯಾವ್ ಜಂಕ್ ಔಟ್ಸೈಡ್, ಅದು ಏನೇನೋ. ಇಫ್ ಐ ಆಮ್ ನಾಟ್ ಹಂಗ್ರಿ, ಸ್ಪೆಷಲಿ ವೆನ್ ವಿ ಹ್ಯಾವ್ ಚಿಲ್ಡ್ರನ್ ಅಟ್ ಹೋಮ್, ಮಗು ಹಸುವಾಗ್ತಿಲ್ಲ ಊಟ ಮಾಡು. ಸೊ ವಿಚ್ ಪಾಯಿಂಟ್ ಟು ಐ ಟ್ರಿಗರ್?
You should not trigger the point to top. You have to make him hunger without feeding him. There is no Varmam to do that because the hunger has to be initiated by your inner things, not from outer induced. Because I am not hungry means my peptic system and my digest systems are completely doing some other work. So I am not hungry. Think like that I am doing a happy job, I don't feel hungry. And I am doing irritated task, I take chocolate, that IT guys are all keep on eating and nothing. Why means irritating. So happy job when the kids are playing with an happy thing, they won't feel hunger. Why you want to induce an hunger? Because if you induce an hunger, that's why future they say my child will be, where will I reduce the body, all that you will do because your digest system will spoil it. So feeling that when they are hungry, feed it, and they are not hungry, never even activate it. Even though there is a point, I am not disclosing, frankly telling you, because that's not good for you now.
ಸೊ ಇಫ್ ಐ ಹ್ಯಾವ್ ಇಂಡೈಜೆಷನ್?
Indigestion is, there is no much point in indigestion. Have a food style of eating is there. We have a video also, I'll share with you. You can also post it in our channel. So how to eat itself is reduce indigestion. Indigestion again, if I give a point, double biryani, bucket biryani, and they try to indigest means then you are spoiling end of the day, but cheating the body, that is not, you are not spoiling him. That's not a good way to.
ಸೊ ಈಗ ಸ್ಲೀಪ್ ಗೆ ಅನ್ನ ಯು ಸೆಟ್ ದಿಸ್ ಪಾಯಿಂಟ್ ಹೆಲ್ಪ್. ಸೊ
For study again, people have to scratch here 3 times. Knock, 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 knock. So it will work. Also sittings you can do like we call basket audio, going down and coming up. Inhale you do when you go up, exhale you do when you come up. That will trigger your mooladhara energy directly to the head. That's a beautiful one. So that goes up means that your ಪೂರ್ಣಲು ವರ್ಮಂ ಏನು ಜನಿವಾರ ಹಾಕ್ತೀವಲ್ಲ, ಜನಿವಾರದಲ್ಲಿ 2 ಪಾಯಿಂಟ್ ಇದೆ, ಅದು ಪೂರ್ಣಲು ವರ್ಮ ಅಂತಾರೆ. ಅದು ಏನಾಗುತ್ತೆ ಓದಕ್ಕೆ ಅದಕ್ಕೆ. ಸೊ ದಿಸ್ ಸೈಡ್ ಯು ಪುಟ್ ಜನಿವಾರ and pull it here and re-rig edur Sam Adharvana Veda, you will clearly understand that's why there is a mudra to hold the janivara in feeding that. That mudra when you pull it, back side the point is pressing and the breath will come to the right side. Surya Galar, automatically your study became concentrations complete on the curve. And when you go to the death, these people change the janivara because there I cannot give the anger there because Surya Gala is an anger. So I'll move to Chandrapada so that what will happen, I'll adjust with all the emotional thing and I'll also be with their emotion and come out. That's why we shift to change the breath.
Oh my goodness, okay.
That's why in the marriages, in our side and also bride side, they have to arrange the marriage. The bride father will have the bag here with the cash there. You'll be moving here and there. You will not enjoy the marriage at all. Come, utaita, chenaita, stay. But bride mother and bridegroom mother will be on the stage beautifully. But this father won't be there in the marriage at all. So much money you spend, you will not get. Ask him, just take this bag and ask him to keep it safe for 2 seconds. And you'll see, you will be leaning at the pillar and watching the daughter smiling there and he'll also society. That much of emotional canopy will happen, just changing the breath.
So the breath change happens when your arm...
That's yoga danda, they use it. This uses the yoga danda to change the breath according to the people in front of them or they are in the meditation.
So yoga danda kept here, active as well?
Left breath. So that's why whenever you go, you see his right hand is up, then you go, you'll bless you. If you go to left hand, he'll curse you. The reason is that he is in the deep penance of meditation, so he won't.
ಓಕೆ, ಸೊ ಎಷ್ಟು ವರ್ಷಗಳಿಂದ ಇದನ್ನ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಹೋಗ್ತಾರೆ?
Now almost 29 years this.
ಸೊ ಹೌ ಮೆನಿ ಪೇಷಂಟ್ಸ್, ಹೌ ಮೆನಿ ಸ್ಟೂಡೆಂಟ್ಸ್?
Students, we have almost touched 5,000 students. Patients, I don't remember, sorry about that, because we don't document that in the right way. And because I don't treat directly, we'll have a clinic, authorized clinic, doctors will be there, registered therapist will be there, trained therapist will be there, and they'll be taking it.
ಸೊ ಯಾರಾದ್ರೂ ಇವಾಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇನ್ಸೋಮ್ನಿಯಾ ಅಂತ ಬಂದ್ರೆ, ಅಥವಾ ಬೇರೆ ಯಾವ್ದಾದ್ರು ಸೈಕೋಸೊಮ್ಯಾಟಿಕ್ ಡಿಸೀಸಸ್ ಅಥವಾ ಜಸ್ಟ್ ದಟ್ ಜಾಯಿಂಟ್ ಪೇನ್ಸ್, ಐ ಆಮ್ ನಾಟ್ ಏಬಲ್ ಟು ಬೇರ್ ದಟ್ ಪೇನ್ಸ್, ಮೇ ಬಿ ದ ಏಜ್ ಫ್ಯಾಕ್ಟರ್ ಸಮಥಿಂಗ್, ಎಷ್ಟು ದಿನಗಳ ಕಾಲ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋಬೇಕಾಗುತ್ತೆ?
Other will only one day will call and will die then also. If they don't follow, only then will call it. Second thing. And some people, they ask the prakruti, immediately they cure. Some people come after 10 years of problem. They expect result in 2 days. It's impossible. So some people has to bless their Kuladevata before coming, and they have to believe that my treatment is done through their Kuladevata's hands, not my hand. There, that cases really get successful research more than they're expecting. Ramesh Babu is taking care. That level we fail mostly. Those who just surrender to the Kuladevata, because karma clearance should happen by Kuladevata. That's a belief from our system. So you have to believe that your Kuladevata only allowed you to come to me, even for an interview. And you have to feel that the Kuladevata only is doing all this through me. So I am idiot. I am just emptiness. Once emptiness, then the quantum physics says the higher energy will come and fill you. Only then the healing will happen. Most of the people say, "Ba, naan nodkotini anta." That people are diseased already. Check it. Do the back check. They will have the diabetes. They will have the BT. You do my back check. I'm 55 now. You will not see any tablets I'm taking for any reason. You know why? What we teach is the same way we are living. So Muladevata is most important. So what result is purely upon their belief system and their acceptance system and their surrender system. Belief, acceptance and surrender. These three are like making one day. 15 years could not walk lady. She's often doing the tucking now. She's climbing the hills. Her age is, so much aged. 15 years of problem. Age is almost around 72 when she put the treatment. Now almost 7 years. She's climbing the Sadragiri, you know that? One treatment, because she is in the blessing foot of Sadragiri, where Shiva, and she surrendered to my healing. She knows Varmam is from Shiva, and my hand made magics because she believed that, like, your mother cooked something, you cooked something. Same kitchen, same items, difference of taste is there. You agree with me? I sit in with the plate, dosa comes from kitchen, my mother and wife is inside the kitchen. The dosa will tell who person. She's talking. Nice ghee, roasted, that's my mother. Maga ಚೆನ್ನಾಗಿರ್ಬೇಕು, ಸ್ಟ್ರಾಂಗ್ ಇರ್ಬೇಕು ಅಂತ. ಬರೀ ಪ್ಲೇನ್ ಸ್ಟೀಮ್ಡ್. ಮೈ ವೈಫ್ ಆಲ್ರೆಡಿ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಇದೆ, ಅವರು ಚೆನ್ನಾಗಿರ್ಬೇಕು ಅಂತ. ದಟ್ಸ್ ಡಿಫರೆಂಟ್. ಆಂಗೋ ಅಪ್ ಲವ್, ಬಟ್ ಸ್ಟೀಮ್ ಇದ್ದಾರೆ ಅಂತ. ಬಿಕಾಸ್ ಯು ನೋ ಮೈ ಪ್ರಾಬ್ಲಮ್ಸ್, ಮದರ್ ವಿಲ್ ನಾಟ್ ಕೌ. ದಟ್ಸ್ ಇಟ್. But dosa is talking. Same way your touch is talking. Same way your healing is talking. You receive it, then you'll get to it in one day.
ಸೊ ಯಾವುದೇ ಕಂಡೀಷನ್ಸ್ಗೆ, ಎಸ್ಪೆಷಲಿ ನಿಮ್ಮ ಜಾಯಿಂಟ್ ಪೇನ್ಸ್ ರಿಲೇಟೆಡ್ ಕಂಡೀಷನ್ಸ್ಗೆ, ನಿಮ್ಮ ನರ್ವ್ಸ್ ಇಶ್ಯೂ ರಿಲೇಟೆಡ್ ಕಂಡೀಷನ್ಸ್ಗೆ, ಹಾಗೆ ಸೈಕೋಸೊಮ್ಯಾಟಿಕ್ ಡಿಸಾರ್ಡರ್ಸ್ ಅಲ್ಲಿ ಈಗ ಡಿಪ್ರೆಷನ್, ಆಂಗ್ಸೈಟಿ, ಆಂಗರ್, ಏನೇ ಇಶ್ಯೂಸ್ನ ಡೀಲ್ ಮಾಡ್ತಾ ಇದ್ರು, ಅಥವಾ ಮಕ್ಕಳಲ್ಲಿ ಓದೋದಕ್ಕೆ ಸಮಸ್ಯೆ ಆಗ್ತಾ ಇದೆ ಅಂತ ಅನ್ಕೊಂಡ್ರು, ಈ ಎಲ್ಲ ಸಮಸ್ಯೆಗಳಿಗೆ ನೀವು ಒನ್ ಡೇ ಸೊಲ್ಯೂಷನ್ ಸರ್ ಕೊಡ್ತಾರೆ. ಅವರ ಬ್ಯಾಂಗ್ಳೂರ್ ಕ್ಲಿನಿಕ್ ನ ಅಡ್ರೆಸ್ ಹಾಗೆ ಅವರ ಡೀಟೇಲ್ಸ್, ಅವರ ಫೋನ್ ನಂಬರ್ ಎಲ್ಲವನ್ನು ನಾವು ಡಿಸ್ಕ್ರಿಪ್ಷನ್ ಬಾಕ್ಸ್ ನಲ್ಲಿ ಶೇರ್ ಮಾಡ್ಬಿಡ್ತೀವಿ. ಸೊ ಯು ಕ್ಯಾನ್ ಆಲ್ವೇಸ್ ಗೆಟ್ ಇನ್ ಟಚ್ ವಿತ್ ರಮೇಶ್ ಬಾಬು ಸರ್ ಅಂತ ಹೇಳ್ತಾ, ದಿಸ್ ವಾಸ್ ರಮೇಶ್ ಬಾಬು ಸರ್ ಆನ್ ವರ್ಮಕಲೆ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಸರ್.
ಒಂದು ನಿಮಿಷ, ಎಲ್ಲಾರು ಕಲ್ತಾರೆ ಬರೀ ವಿಡಿಯೋ ಹಾಕ್ತೀರಾ, ಮಾರ್ಕೆಟಿಂಗ್ ಮಾಡ್ತೀರಾ ಅಂತ ಇಲ್ಲ. ಲೆಟ್ ದೆಮ್ ಲರ್ನ್ ಸಮ್ ಟೆಕ್ನಿಕ್ ಟುಡೇ.
Yes, please.
That's most important, no? So let's give them something. Watching, it's a takeaway. Takeaway ಏನಂದ್ರೆ ಏನ್ ಬೇಡ ರೀ. Whenever you are depressed and you feel you are alone, you want a companion, then what you do, it's a very easy technique, is that just sit relaxed, cross your leg, whichever the leg you want, and fall to that leg which is above with that same side hand. First, massage this leg for a few seconds. What happens this, I am telling you, because this is a prana energy which comes automatically to you, and whichever the leg you are crossing, accordingly you will have the emotion inside you. Just press this leg for exactly 3 minutes. And just lie down, palm up and lie down, and a few seconds, you just, small jerk will happen. After that you get out. You will not have any emotion at all. You are emotionless, I'm telling you. That means who is there, who is not there, none of your business. Still you get into your job. No one puts a Facebook after this practice that I am alone, I am lonely. That status has to be killed in the Facebook. if you use this particular technique. Very simple. All gurus does.
ಇಫ್ ವಿ ಕ್ಯಾನ್ ರಿಪೀಟ್, ನಿಮ್ಗೆ ಲೋನ್ಲಿ ಅಥವಾ ಏನು ಡಿಪ್ರೆಸ್ ಅನ್ನಿಸ್ತಾ ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ ನೀವು ಒಂದು ಕಾಲ್ ಮೇಲೆ ಇನ್ನೊಂದು ಕಾಲ್ನ ಹಾಕೋದ್ರೆ ಯಾವ ಸೈಡ್ ಆದ್ರೂ ಹಾಕೋಬಹುದು. ಅಂಡ್ ಆ ಪಾದನ ನೀವು ಫಾರ್ 3 minutes ಮಸಾಜ್ ಮಾಡ್ತೀರಾ ಅಂಡ್ ಆರಾಮಾಗಿ ರಿಲ್ಯಾಕ್ಸ್ ಮಾಡ್ತೀರಾ. ಆ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಎಂಡ್ ಆಗೋ ಹೊತ್ತಿಗೆ ಯು ವಿಲ್ ಬಿ ಫ್ರೀ ಫ್ರಮ್ ಡಿಪ್ರೆಷನ್ ಅಂಡ್ ಲೋನ್ಲಿನೆಸ್. ಸೊ
ಇದು ವಿಷ್ಣು ಟೆಕ್ನಿಕ್ ರೀ. ಇದು ವಿಷ್ಣು ಅಂದ್ರೆ ಲಕ್ಷ್ಮಿ ದುಡ್ಡು ಅಂತೀವಲ್ಲ, ಲಕ್ಷ್ಮಿ ವಿಷ್ಣು ಕಾಲ್ ಟಚ್ ಮಾಡೋದಂತಾನೆ ಲಕ್ಷ್ಮಿಗೆ ಅಷ್ಟು ದುಡ್ಡು ಬರ್ತಾನೆ ಇದೆ ಆಟೋಮೆಟಿಕ್. ಅದಂದ್ರೆ ನಮ್ ಕಾಲ್ ನಾವು ಮುಟ್ಟುವಾಗ ಏನ್ ಆಗತ್ತೆ ಅಂದ್ರೆ ದ ಹ್ಯಾಂಡ್ ಎನರ್ಜಿ ಅಂಡ್ ದಿಸ್ ಇಸ್ ಕನೆಕ್ಟಿಂಗ್. ದಿಸ್ ಈಸ್ ಸಮಥಿಂಗ್ ಲೈಕ್ ಅಪ್ಪರ್ ಕ್ವಾಂಟಮ್ ಫಿಸಿಕ್ಸ್ ಅಂಡ್ ಲೋಯರ್ ಕ್ವಾಂಟಮ್ ಫಿಸಿಕ್ಸ್ ಎಂಟ್ಯಾಂಡಿಂಗ್ ಆಗುತ್ತೆ. ಎಂಟ್ಯಾಂಗ್ಲಿಂಗ್ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ದ ಗ್ರೌಂಡಿಂಗ್ ವಿಲ್ ಹ್ಯಾಪನ್ ವೆರಿ ಫಾಸ್ಟ್. ಇನ್ನೊಂದು ಕಾಲ್ ಕೆಳಗಡೆ ಇದೆಲ್ಲ ಅದಲ್ಲಿ ಗ್ರೌಂಡಿಂಗ್ ಆಗ್ಬಿಡುತ್ತೆ. ಸೊ ಆಲ್ ನೆಗೆಟಿವ್ ವಿಲ್ ಬಿ ಡೌನ್. ಆಲ್ವೇಸ್ ಓನ್ಲಿ ವಿಚ್ ಇಸ್ ಡೌನ್ ಇಸ್ ನೆಗೆಟಿವ್ ಎನರ್ಜಿ. ದಟ್ ಮೀನ್ಸ್ ಮೈ ಥಾಟ್ will go there. Upper one is saying upper end timer. So when you press this point, the good side activity are increasing. Prana ಜಾಸ್ತಿ ಮಾಡ್ತಾರೆ, ಒಳ್ಳೆದ ಥಾಟ್ಸ್ ಇದೆ ಅಲ್ಲ ಅದನ್ನ ಜಾಸ್ತಿ ಮಾಡ್ತಾರೆ. ಅವಾಗ ಏನಾಗುತ್ತೆ, ಬ್ಯಾಡ್ ಥಾಟ್ you go away. ಅಷ್ಟೇ. It's a science behind that. It's a pure science.
ಸೊ ವಿತ್ ದಿಸ್ ಟೆಕ್ನಿಕ್ ವಿ ಕಮ್ ಟು ದಿ ಎಂಡ್ ಆಫ್ ದಿ ಕಾನ್ವರ್ಸೇಷನ್. ಸೊ ಸರ್ನ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡೋದಕ್ಕೆ ಡಿಸ್ಕ್ರಿಪ್ಷನ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಡೀಟೇಲ್ಸ್ ಇರುತ್ತೆ ಅಂತ ಹೇಳ್ತಾ, ದಿಸ್ ವಾಸ್ ಟುಡೇಸ್ ಇನ್ಫೋ ಹಾನಡಿ ವಿತ್ ರಮೇಶ್ ಬಾಬು ಸರ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಬೀಯಿಂಗ್.
Thank you.
ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ನಿಮ್ಗೆ ಯಾವುದೇ ರೀತಿಯಲ್ಲಿ ಮಾಹಿತಿ ಕೊಟ್ಟಿದ್ರೆ, ಯಾವುದೇ ರೀತಿಯಲ್ಲಿ ಸಹಾಯ ಮಾಡಿದೆ, ಅಲ್ಲಿಗೆ ನಮ್ಮ ಕೆಲಸ ಮುಖ್ಯಗೆ.